Hello, everyone. My name's Teresa Snyder, and I am currently in Amarillo, Texas, where, it's a little rainy, a little cloudy today. You never know what you're going to get in the Texas Panhandle. And I have this newfound amazing friend, Dr. Nolan Farmer, and I want him to introduce himself, and then we'll dive into, we're going to make it as a lighthearted as a subject as possible. But Dr. Farmer, would you please introduce yourself so everyone knows who you are?
Yeah, like I said, hi, I'm Nolan Farmer. I'm originally from here in Amarillo, Texas. Recently graduated residency this year, so took on a faculty position here at Texas Tech Health Science Center and the Department of Family Medicine in July. So we just started practicing in the last few months, and it has been great. I'm married, have 2 kids, and I love to do magic. So I do a lot of card tricks and fun stuff like that.
I know that was the first thing whenever I met you. You had a deck of cards or a few decks of cards on your desk, and I said, You must know how to do magic tricks.
I feel like so. Dr. Anderson and I kind of go back and forth with each other on who's the best magician. I would say I'm the best in the
You are.
department. Yeah, definitely the best in the department.
Yeah, absolutely. We're going to say that all day long. And whenever he watches this video, or is it Dr. Anderson? What?
I don't know if things got cut off or
What's
if we
his first name?
froze. Are you still there?
Oh, yes. Okay.
Okay.
You there? Okay.
Yeah, I think we got cut off.
You got a glitch for a second. You know why? Because I was saying that you're the best and no one else knows.
That's right. Someone must have not wanted to hear that.
Well, let's make sure they hear it. Oh my God. So you hit the ground running.
Yes.
Like fly, and here you are, and wow, and oh my gosh, and now it's October, and I'm asking you, can we talk about this live? And you're like, okay, and here we are. So thank you.
Yeah.
Thank you for your time. I acknowledge you for that.
Absolutely.
And I know for me, I have come back into the world of healthcare, and I only recently came back in March, so it's been during the pandemic. Before that, I was a pharmaceutical rep. Before that, or right before this particular position, I was a media host and really got to learn and travel and meet people. So now I get to incorporate both. And that's why I really wanted to have this conversation with you.
Mm-hmm. Yeah, what an interesting time to start back in healthcare.
I know. We'll never forget it.
Yeah, definitely.
We will never forget it. And I know that I was just going back through my timeline of things and thinking about how old, my age and experience and all those kinds of things. That Matthew McConaughey, I remember meeting him in Amarillo, and that was in like 1995. Like,
yeah. I can't remember why. I guess he owns a house here, or his family does, or something in the area. I don't know why he comes down here.
Well, and I could tell you that whole long story sometime, but let's get into you. Let's talk about you. We're not worried about Matthew McConaughey. We're here with Dr. Nolan Farmer. So tell us a little bit about you, and maybe what I really want to talk about the paradigm shift in palliative care, hospice care, what your experience is.
Yeah. So, like I said kind of earlier, just recently graduated from residency here in Amarillo. I went to medical school in Fort Worth at University of North Texas Health Science Center. I graduated from there in 2017, and then with the Department of Family Medicine here, graduated this year, and then started my faculty position here in July. I actually my first interest in hospice palliative care, or geriatrics even for that matter, but hospice palliative care specifically, was in medical school. So the University of North Texas has a really great geriatrics and hospice palliative care program and they have a good rotation that the students, it's actually a core requirement for the students to go through. And it was really enlightening uh, rotation for me. And then had the opportunity in residency to actually have a few electives where I got to do both hospice palliative care on the inpatient side, which is a little bit different experience from as opposed to the hospice palliative care from the outpatient side. I got to do both of those and see what it looks like from the clinic perspective as well as the inpatient perspective. And as a student, as a resident, I knew it was something I was going to want to incorporate into my practice and something to be able to help provide lead discussions with my patients, and also be the provider in that field for potentially my patients and other patients as well. It has definitely been for me, it's definitely been a big learning experience. I think I still have a lot to learn when it comes to hospice palliative care, but the conversations that we have with our patients, and the primary conversation always comes to the goals of care for the patient. And that's kind of the patient-centered focus, is what we're trying to offer is if I were to put myself in that situation, what would I want in these, if I'm at the, if things are terminal or whatever, what have you be, if I were in this situation, what would I want for myself, or what would the patient want for themselves? And I get to kind of walk through patients with those conversations.
Yes. And I always tell people that. What would you want for your own family member?
Mm-hmm.
And where is it that you're going to have the best quality? And I actually met with someone yesterday, and he's a COPD patient, really struggling, wasn't sure what he wanted to do, yet he's been going to the hospital quite frequently.
Mm-hmm. Yeah, and it's a for sometimes I kind of always, it's initially hard to bring up because I feel like hospice palliative care, they kind of have this bad connotation. If you bring up the word hospice, it's a trigger to a death sentence. And what I really like to really tell patients, this is not what it is. It's just we change the goals of care, and the way, just a simple changing just a goal, the way we change the way we phrase things. We go from when we know that we're reaching what I would call futility, where we are no longer doing things for patients, but doing things to them. I feel like that we can change the goals from this aggressive, going to the hospital, staying weeks in the hospital, being lab work, IVs. I mean, these things that your days at home become more limited. You're spending more time in the hospital than with family. And so we can change goals of care from being in the hospital, being readmitted, to more of a comfort approach where you can be at home. You can have these amazing resources provided to you at home, nursing, medications to keep you comfortable, medications to, if it's COPD, like you said, to help calm down that air hunger, that breathing, to really change the goals of care, because we know what happens at the end of life anyway, and how can we make those last few months of life the most comfortable, and to be surrounded by family as opposed to in a hospital.
Absolutely. Well, everything you've said today has been extraordinary, and I think this is a conversation that we're going to be able to have again and again if you're open for it.
Absolutely.
I love the way that you discuss it. It's about education. It's about people being at home. And I don't want to get technical. You're making it to where it's more layman's terms, more what the patient can understand. And I really, really appreciate it. So what do you want to say, just kind of to wrap all this up and put a bow on it?
Yeah. And of course, I try to say, we see our patients, and if you're in a primary care setting, or if you're a physician, if you're seeing a primary care doctor, these conversations are much easier to have early on with your provider, or with your patient. The hardest conversations are when we're already in the hospital, and where things are going downhill in that scenario, because then we're making much more difficult conversations. I much prefer to have these conversations early on, set expectations early, and really learn, for my patients. I want to know what their actual goals of care are. What is it that they want, and long term. And even if I have someone who may not qualify for hospice, but we know the progression of certain diseases, say 2-3 years down the road, what is it that you're going to want when we've reached, like I said, futility, or when we've done all we can do medically? What are your goals? And so trying to establish those things early, I think, is one of the most important things to do for our patients.
It's very advantageous.
Mm-hmm.
Yes,
Yeah.
absolutely.
I hope that kind of puts a bow on things. I may complicate
No,
them.
no, it did not. I think there are just conversations that we
Mm-hmm.
need to be having, and the earlier, the better, is what I'm hearing you say.
Oh, definitely.
And as we
Definitely.
close out, I just want to acknowledge you for your role in helping patients. I want to acknowledge you for who you are for people just out in the world, and that you're absolutely wanting to make a difference. And I look forward to working with you further. And I would really love for us to do this again. And
Absolutely.
thank you. Is there anything in closing?
Oh, I wish I had a good closing. Otherwise, the only thing I would say in closing is just everyone be very safe, especially if you're in the Amarillo area right now. We have a lot of COVID cases, so that's just kind of a general statement, being very safe and taking care of yourself.
Absolutely. Well, my name's Teresa Snyder here in Amarillo, Texas, with Dr. Nolan Farmer at Texas Tech Family
Mm-hmm.
Medicine. We will do this again soon. Take care, everybody.
Thank you.